it's me. Is my chair too low? Oh. Yes, an update. Woohoo! Another one. I went in for. Hold on. Better? Okay. Slightly higher. I went in for genetic testing, counselling yesterday. And we talked to this young woman. Went in with Wade and Holly, and I can't remember her name. I don't remember anybody's names because this is all very, very, very stressful and scary for me. So I just, things are going in one ear and out the other and stuff. And these floaters in my eyes are so annoying. Not that that's got anything to do with anything, but anyway, yeah. We talked. I don't have much of a history to give her. I didn't. So it's not that we could say, oh yeah, you're the prime candidate for this, because I really don't know anything on my dad's side. Other than my dad and his brother, and then on my mum's side, other than my cousin, who the genetic counsellor said that cervical cancer is more an HPV thing rather than a hereditary thing. I need new glasses because these ones I've washed so much that the actual coating has come off, so they always look cloudy. And my other ones that are actually this prescription I don't like them. Then I've got old prescriptions which I'm not going to wear. Yes, so she said, well, we'll do the test. We told her that the insurance says they'll cover 85%, but she said the lab will call the insurance company just to make sure, because they have to, and then they'll let us know how much it's going to cost, our part, and then we say yes or no. And she gave us the option of doing blood tests in another building, or the other option was just to do this, spitting into these two little vials, about this much. And since I hadn't had anything within half an hour, I was able to do that. And so we did that. And so if in the off chance that it does come back positive, then Holly, Billy and Oliver will have to get tested just in case that theirs comes back positive. And then if not, then they don't. But if it does, I also have to have my brother and my mum test, because it would have come from one of my parents. And then if my brother tested positive, this is if it comes back positive. She says a lot. Most of the time it doesn't. For these things, so sometimes it does. I don't know. And that would also help determine what surgery to do. Then we went, and that was 11:30. Then at 2:30 I had the biopsy, and they got this new machine 3 weeks ago, which was just after I'd had the biopsy. And this machine is a sitting up machine, and because the one I did before was you had to lie down there and your boobs had to go through this hole. And this one, just like with the MRI, but with this one, you sit up and they pull your boob through this thing, and because it's further back than the calcifications, which is still quite high up, they pulled all the flesh from my body into this thing. And because I've had the tummy tuck and there's very little give beneath the breast structure, it kind of ripped the skin underneath my breast, and half my muscle wall was pulled into this thing as well. That was the bit that was hurting. It wasn't the breast being squished, which isn't comfortable, but it's tolerable. It was the muscle being pulled into this thing that was so uncomfortable. And then after about 20 minutes of trying to get it, because it was a really difficult position to get it, and because I was so far forward in the machine, they kept getting my chin in the picture. Anyway, finally they got it, and they said, oh, let's go get the doctor. And then the doctor comes back in, because I'd already spoken to her once. And then they couldn't get the computer to correspond with to connect with the biopsy machine. And so they went through this process with the company that Wade had gone through with Comcast the night before, where they had to unplug things, plug things back in a certain order. Then they had to read out the serial numbers on the machine because it's a brand new machine, and they were saying, oh, I've used this machine for 3 weeks, I've used it 5 times and it works really well, and blah blah blah, and it's not working, and it's not. Anyway, after about an hour, and they'd put my boob in, then they'd take it out, and anyway, that's how I got torn underneath a little bit. Then they said, do you have an appointment? Do you have anything to do after this? And I said, yes, I've got a 4:30. And they said, oh, yeah, they're going to send a technician out, but it's not going to be done in the next, 40 minutes, which was how long I had for my appointment. And so I thought, oh, so I have to go back tomorrow. But the thing that I found out yesterday, which is something that Laura's told me, is that there is a team on my case already. I didn't know about this, but the doctor I saw yesterday, again, I don't know her name, has been talking with the guy who told me I had this, and said they were looking at the mammograms, the ultrasound, the MRI results, the biopsy, and they still can't figure out what it is that's behind the calcification. There's some healthy tissue behind the calcifications, and then there's this little thing, and they don't know what it is. It could be a fat thing, it could be a bit of cancer, it could be a frog, I don't know, it could be a fibroadenoma, it could be anything. It could be a cyst, it could be, they want to know what it is. Normally, before this machine, they would have just taken the tissue, the healthy tissue and the tissue underneath out and tested it, but now they can biopsy it and see what it is, so that if it's nothing, if it's just like nothing, then they can just leave it and just take out whatever it is, the bits of calcification out, if I go with a lumpectomy. So yeah, so we still don't know what's going on with the surgery side of things. I still haven't spoken to Dr. Blanchard, and this puts us off another 2 days, which means the weekends in between, which takes us a few more days closer to Christmas, which means, again, nothing's going to happen. The genetic testing takes 3 to 4 weeks to get results, so again, what am I supposed to do? The lady that I spoke to while we were waiting, the technician at the biopsy place, she said, for this stage, most doctors now these days are going towards tissue conservation, and opting for the lumpectomy with radiation, because everything is the same, whether you do mastectomy or lumpectomy with radiation. But I still don't know what I'm going to do. The other thing is, let's not talk about that anymore, because I'm done. I'm worked up about it. I mean, one of the things that you're thinking about is, every little niggly pain, you think, oh my God, it's gone somewhere else, and got finger pain, oh my goodness. And these things like my shoulder's been hurting, maybe it's not just a pulled muscle and nerve, thing anymore. Maybe it's something else. Maybe it's something sinister. Maybe something's eating away at my shoulder now. Incidentally, my shoulder's getting better. Because I haven't been lifting weights, and I've just been doing it without weights, my weight stuff without weights. I can now move my arm to this, like before when I'd get out of the shower, I couldn't dry myself, like my armpits and my arms, because I couldn't move my arm across, but now I can. Look, I can touch my armpit. Stupid woman. Anyway, I was going to do just a little tiny tutorial. I have I do my nails. This time it's silver, and the colour is foil. It's called Silver Chrome Foil by Orly Colour Blast. It's this colour. I noticed that I had a split underneath the actual nail line, so it's actually where there's flesh, so you can't rip off the nail or cut it off or whatever. And this, I noticed this a couple of weeks ago. I thought, oh great, breast cancer and a broken nail. Anyway, I found some stuff online, so I thought, I'd seen this ages ago, and I'd taken a screenshot of it, so I thought I'd try it. They suggested putting fabric on it, gluing it, filing it, buffing it down, gluing it, then putting some fabric on top, and then buffing down the fabric. But I thought, oh, let's be smart, and I got a little Band-Aid, a plaster, and I stuck it, cut a little piece out, stuck it on my nail with glue, nail glue, and I use the 5-second brush-on nail glue. And then I put more layers of nail glue, let it dry. It doesn't dry in 5 seconds with fabric on it, I'll say that. Then I let it dry, and this time I didn't buff it all down to nothing because I didn't think it held that well. But I found since that there's a different trick that you can use. You can use tea bags, not with the tea leaves in, obviously, because then you'd find yourself with a very lumpy fingernail. But you just use the actual tea bag fabric, I guess, paper, whatever it is, and you stick it on and you buff it, and then you put more glue, and then you buff it and you put more glue, blah blah blah, yakety smackety. Anyway, it's holding. I did this on Sunday. It's holding. I didn't use a tea bag. I used the Band-Aid with lots of layers of glue. Didn't even bother to buff it down because I thought I put 3 layers of the base coat, which is for ridges, which helped. I mean, you can see it in the light that there's a big wodge of Band-Aid, but you can't really see it. I mean, it looks... I've cut the nail down shorter than I normally would, but it's holding. It's been 4 days. I do stick a little bit more glue on the side, just on the edge. As soon as it grows out long enough, I know this is boring, but I know as soon as this grows out long enough, I'll just cut the nail off and have a short thumbnail and just not show my thumb. Anyway, that's it. But yes, this is 10 layers of nail varnish. There were 3 layers of the base coat, 2 of silver, 1 of clear, which is 3 of silver, so that's 6. 1 of clear, which was perfect, so that would have been 7, perfect. Then I was stupid and put another thing of clear, and it made the colour go really weird, like it had waves, like it'd been on underwater, and it was like all weird underneath. So I thought, oh no! So that's 8. So I put another 1 of silver again, 9, and then another of clear, 10. That means that this actually doesn't look like there's anything really, unless you catch it in the light, holding the nail together. But that's it! End of boring nail thing! So tomorrow I'm going back to the imaging centre, and I'm having the biopsy done. Hopefully this time it will work, and then we'll find out what this thing is, and that will take 2 business days, so probably not till next Tuesday or Wednesday. I'll hear hopefully back from the doctor, and then we'll see what to do next. Nobody seems in any hurry, but at least they're talking about it, and they're discussing my situation, and yes. Anyway, thanks for watching. Keep sending me good, positive, like, health vibes and all that kind of stuff. I just want this thing out of my breast. I don't know how I'm going to do it yet. But I saw Dr. Felady again this week, and we discussed that again. And then I told him about my belly button, which has gone really thick. And there's very little hole now. Not much of a hole. It's just very thick, and it's a ridgy thing. And it's kind of purple, and it looks like it's hypertrophying, whatever the word is. So he did 4 or 5 shots of steroid in. I've had that done before on my shoulder, I think. Yeah. I had radiation on my shoulder as well to make it not come up. Anyway, so I had 4 or 5 shots of steroid in it, and I didn't feel a thing. I mean, I felt a little bit of tugging, but I didn't really feel. I thought, is that a needle? Did you just use a needle? He's like, are you feeling that? I said, no. So let's see how that goes. He says the steroid should soften the tissue, and then maybe I'm going back next week, so maybe he'll put some more in. But at this point, it's not like the uppermost thing on my mind at the moment, shockingly enough. Anyway, thanks for watching, and I'll see you next time. Send me good vibes, please, and good vibes back to everybody. And I'll see you soon. I hope Christmas things are getting done. Our tree is up. Oh yes, last time I put a picture of me next to the tree. Alright, thanks for watching. Bye. 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 Bye.